wherever you are. My name is I'm the practice manager for the urban development and DRM team of the World Bank in East Asia. Welcome to the 20th edition of Cities in the Frontline. It's hard to believe that we've had weekly conversation for 20 weeks now on this topic, and it doesn't seem to be abating. Last week, I indicated that we would now start exploring cities' response to the COVID-19 crisis in particular sector. And it is hard to think of a sector that is more at the core of the needs of communities affected by this virus, more than the water and sanitation sector. Today, we will explore how cities, and in particular their water utilities in Kigali and in Cape Town, have been responding to the needs of the community they serve. As a bonus, we'll have intervention from two individuals who are also deeply engaged on the water and sanitation agenda over the world. Lauren will introduce these speakers in a minute, as well as the two discussants I just mentioned. But first, let me remind everyone of the intention of this speaker series and the ground rule for the conversation today. The purpose of these global webinars is to have open and honest learning conversation between practitioners in cities and government and partners supporting those entities. The calls are not on the record, and we ask that you not attribute any comments made today or question asked to the speakers unless the material are made available after the call or you have the person's express permission to do so. We're thrilled at the response to this seminar with close to 400 people registered for the call globally. And to facilitate this discussion, as a matter of practicality, we ask that you use the Q&A function to ask your questions. Please note that the recording for the session, as well as the PowerPoint presentations, will be posted online probably by Monday. Lauren, over to you.
Thank you, Francis, and good evening to everyone from Singapore. It's my pleasure to introduce tonight's very exciting lineup. We have 4 speakers, 2 from the Global Resilient Cities Network's cities who are going to share on-the-ground experience, and then 2 experts. So let me give a brief introduction to those speakers. First, we're going to hear from Mr. Japheth Habinshuti. Japheth is a Chief Resilience Officer at the city of Kigali, and as the Chief Resilience Officer, he's responsible for driving development and implementation of the Kigali Resilience Roadmap. He's also a member of our Global Steering Committee. Before this, he spent years working at the UNESCO office in Kinshasa in the Congo, and he was coordinating the Natural Sciences program, including overseeing international hydrological programming. So we're really thrilled to have Japheth with us tonight and to hear from him. After Japheth's presentation, we're going to be hearing from Michael John Webster, who is the Executive Director, Water and Waste from the city of Cape Town. In this role, he's responsible for providing utility services to over 1 million households that range from informal settlements to cluster housing, and focuses on delivering these services in a sustainable, equitable, and affordable way. He's no stranger to the World Bank. Before this, he spent many years, 16 years in fact, working on water operations in over 24 countries. So we're looking forward to hearing from him after that. We will then move to a panel, and we'll have 2 discussants to kick us off. The first is Jennifer Sara, who's the Global Director for Water at the World Bank in the World Bank's Water Global Practice. She has 30 years of experience on global water issues with the bank, including as sector manager for sustainable development based in Hanoi, where I had the privilege of being her neighbor and working with her across the office from the Asian Development Bank, as well as prior to that, leading many operations in Latin America and the Caribbean. Then we will hear from a man who needs very little introduction, a colleague and a friend, Henk Ovink, who is the Special Envoy for International Water Affairs at the Kingdom of the Netherlands. And he helps to bring Dutch expertise in water management to the world. He has served on President Obama's Hurricane Sandy Rebuilding Task Force, and he's currently a Sherpa of the high-level panel of water at the United Nations. Both Jennifer and Henk are currently part of the steering group of the Water Action Track of the Global Commission on Adaptation. This action track is aiming to increase the resilience of natural and managed freshwater systems and the critical human systems dependent upon water, reducing risk for 2.5 billion people. So it's an incredibly exciting lineup for you all tonight, so stay with us. I will also say that, unfortunately, I will have to take my leave in a few moments, but I am turning over the co-hosting duties to my close colleague, Dana Omran, who is our Managing Director for Africa, and so she'll be leading the question and answer with Francis for the remainder of the session. And with that, I'm going to turn the screen and the microphone over to you, Japheth.
Hi, everyone. Thanks, Lauren, for giving me the floor. So allow me to quickly take you through some of what measures that Kigali City has taken, particularly in public places, to slow down the spread of coronavirus. And also I will share some learnings to advance resilience in recovery. First of all, the trend of COVID in Kigali and in Rwanda in general. As you can see, we had the first case, first positive case on 14th of March, only 3 days after WHO had characterized COVID pandemic. And since then, the number started increasing. That in just 2 days, we had 7 positive cases. In May, the number has slightly increased, and in June, that's where we had many cases because of the clusters near the western border with Congo, and a small cluster on the border, eastern border with Tanzania. So currently we have 1,582 cases, and many people have been recovering. As you can see, 834 have recovered, and only 5 deaths so far, which is relatively good. And most of the deaths are the people who were brought were in the critical state, health state when they were brought to Rwanda. So I can say that the country and the city particularly did well to contain the virus, because in Kigali, currently there are no new cases that are coming up. So I want to share also on, before jumping to measures, I want to share some of the practices that were already in place before even COVID emerged. You can see that Rwanda were used to basic hygiene practices such as hand washing in their homes, like this woman here, and also in public places. But some months before, due to a potential outbreak of Ebola in the Democratic Republic of Congo, these hygiene measures were intensified. So COVID came when the country was somehow prepared. One important aspect which I want also to emphasize is the existence of community health workers program that promote health behavior at the grassroots level and also provide first line of health service delivery. So these guys played a key role in improving surveillance of community at risk and also in providing timely and accurate information on the pandemic. In terms of access and delivery of basic water and sanitation services, you can see that this figure here gives a picture on the proportion of residents who were potentially at risk due to limited access to wash services. On the right side, these are people who have access to unimproved sanitation services. In total, they are 4.5% of the whole Kigali population. And on this side, people who were relatively at less risk, you can see that 94% have access to improved sanitation, even though some of them share the sanitation facilities with their neighbors. When it comes to improved drinking water, 4.4% of Kigali population have limited access to drinking water, while a big proportion is accessing quality water. And also, only 34% have piped water into their dwellings. Now, these are the measures that were taken, which are closely related to water and sanitation in partnership with the Water and Sanitation Agency. The city ensured a steady provision of quality water and waste management services because they were very critical, especially in the lockdown when people couldn't move. Many awareness campaigns and public education and preventive measures were done and are still going on radio, TVs, mobile sound speakers, recorded messages that featuring public figures on city screens and so on. And also there are frequent hygiene inspections. Also, as you can see, the city also used the robots to decrease the exposure of medical staff in quarantine sites and in treatment centers. And also, the city promoted a cashless payment for all services. It was there, but the awareness was intensified. Now, I want to talk on the role of multi-level governance and decentralized cooperation for enforcing all the measures that I mentioned before. As you can see, sorry, I jumped one slide, this one. As you can see, all the enforcement wouldn't be possible without the role of the civil society that supported the city to expand hand washing stations like this one on the right, and the local businesses that address the face mask demand gap. These are youth volunteers and the security guys who are enforcing hand washing measures, social distancing in public spaces. and they were very key. You can see that it was a cooperation and collaboration between different sectors and different spheres of the society, like the trade cooperative. As you can see, this is the motorists who were very flexible in adopting new measures which were not easy at first. Like, as you can see, this is a smartphone that he uses to get payment, and this is a sanitizer for the clients. So all these wash measures, in addition to many others, they led to these successes. There were reduced number of cases in Kigali. Then the lockdown that lasted around 45 days was lifted. Now we have only 6 neighborhoods that are in partial lockdown in Kigali. Many activities resumed, like church services, as you can see, but people must adhere to prevention measures in whatever they do. So Rwanda was the only sub-Saharan state whose citizens and residents are able to travel to the European Union, and also we are expecting commercial flights to resume on August 1st. Some learnings, we learned that good leadership and good coordination is very crucial in triggering people's action. As you can see here, the president of the country himself raised awareness and was giving a statement to the public on measures and the state of the country against the pandemic. And also solidarity, where everybody was giving his part, and solidarity allowed us to leave no one behind by supporting the poor and the vulnerable. So along with this, there are also resilience policies that were very important to safely navigate through the crisis, like flexibility, in adopting new ways of doing things, reflective, where we learned from Ebola preparedness experience, resourceful, where we capitalized on existing networks, and inclusive. Lastly, the challenges that Kigali is facing are related to the number of households that live in unplanned settlement, which is estimated at 77% of the whole households, whereby 10% of these settlements are seriously overcrowded. So we have water shortage, where there is a production gap of 48 meter cube per day, inappropriate distribution system, lack of pressure management, and also insufficient water and wastewater treatment. So these are critical issues that we are still facing, but we do have measures and strategies in place to enhance inclusiveness and efficiency. In summary, this is how we are doing as a city, and we hope to keep managing the situation, the crisis situation, by learning from the two experiences that are shared. So I wish you to stay safe and healthy while we keep the discussion. Thank you very much.
Michael, I think the screen is.
Yes, I'm trying to share my content. Okay. Greetings, everyone, from Cape Town, South Africa. Great to be with you today. I hope you can see the presentation, and I hope you can hear and see me. It's really a pleasure to be here, sharing our lessons from Cape Town, South Africa, in this COVID-19 network, and particularly on water and sanitation. My name is Mike Webster. I'm the Executive Director for Water and Waste in the city of Cape Town, and that puts me in charge of water and sanitation and solid waste management for this great city. Resilience is a key theme for Cape Town. I'm sure you remember Day Zero and the drought a few years ago, and so building resilience in our water services and the impact of COVID is a very central theme for us. I've been given 12 minutes, so I'm going to have to rush through some of these slides, but you'll have them and you can see them yourselves when needed. This is a quick introduction to the Water and Sanitation Department of the city. We've got 4 million residents to serve. It's rather a busy slide, but essentially 3.5 million of those live in formal households, and we provide 24/7 water and sewage connections through 620,000 connections, 500,000 in informal settlements, and about 45,000 connections to businesses, industry, and institutions. It's a large department, 4,800 staff, with a large operating expenditure of about $420 million US equivalent and 180 million capex. We also have our own bulk supply, unlike many other metros in South Africa. So we have 6 large dams and all the statistics, as you can see. About 65% of our water goes to the formal connections, about 5% to informal, and the balance is to industry. This slide tries to show that actually resilience and building resilience to shocks has been an ongoing theme over the past few years in the city. I realize this is quite a busy slide as well, but essentially if you look on the left, the drought that was there in 2017, which was a 1 in 300 year rainfall event, really was a wake-up call. And I think internationally it was actually a wake-up call as well, where cities realized that a city of this capacity and of this size could actually potentially run out of water. Last year, we had another kind of shock, and that was a water quality shock, where our residents were up in arms about the water quality in our river system. And that graph on the bottom shows E. coli levels in our 21 rivers across the city, about 40% unsafe. And that's brought us to COVID, which is essentially a health and economic shock. And you can see that graph at the bottom showing a GDP forecast for the city that could be a decline of between 11 and 16%, depending on different scenarios that we're looking at. So if we look at water use in Cape Town, the graph on the top right actually shows our water use over the last 50 years. And as you can see, we had a pretty steady growth, about 4% per year until the 2000s, where there was a drought between 2000 and 2002. And then through a lot of water demand management measures, we flattened that water demand to a 1% growth between 2000 and 2015. And then if you look at the main graph on the slide, we had, due to this drought, a massive effort to reduce consumption in the city, and that's brought us to coin the phrase, the #1 water-saving city in the world. Essentially through physical measures, through leak reduction, through pressure management, through water management devices, through financial measures, increasing our tariffs. We had the highest tariffs in the world by far, and through a communication campaign, we drove down that demand by 55% over 3 years, until its low point in 2018, at around 550 megaliters a day. Over the last 2 years, since I've been here, we've been in a recovery mode, and we've been increasing our demand up to about 650, and then COVID hit, and that dropped off by 10% overnight as our industrial and our commercial provision basically collapsed, and we're still in some kind of a recovery mode now. The Cape Town water strategy, which you can look at online, and I'd encourage you to do that, was a response to the drought, and it really committed the department and the city to 5 commitments to our citizens. The second, third, and fourth were all around drought resilience, water-wise use, sufficient, reliable water, shared benefits from a managed from the regional system, and about building water resilience by 2030. At the heart of that program is a 300 megaliter a day infrastructure program to build capacity in groundwater, water reuse, and desalination. Component 5 is the long-term objective. How do we become a water-sensitive city by 2040? But this has also become very important with this water quality crisis, as this has led to a major wastewater treatment program upgrade and a lot of other work in the sustainability arena. But commitment 1, which was our first commitment in the strategy, safe access to water and sanitation for all, and this really speaks to sanitation in particular and informal settlements, actually has become the main issue under COVID. And COVID has given us leverage to add resourcing, to add political importance to this particular commitment, and to really focus on commitment 1. So we believe that through clear priorities like these 5 commitments, through the political will which is there, and through the management capacity that we currently are building, we will be able to effectively implement the strategy. Coming to COVID, these are Cape Town figures. We have about 85,000 cases as of the last few days. We have been at around 2 to 2,500 cases per day since June, and it's predicted that this current peak will continue to flatten out and perhaps decline over the next months, but will be longer and flatter than originally anticipated. South Africa has now the 5th highest number of COVID cases internationally, and Cape Town, center of the South African infections over the last 4 months, until 2 weeks ago when Gauteng took over that position. We have a number of deaths as well. We've got 2,000 deaths as of now, and we've been at around 30 to 40 deaths per day since May. And this compares to a typical mortality rate over the season of around 60, so almost a doubling of our typical death rates over this time. Impact of COVID are essentially on 3 main areas. They are around our customers and around our services, and in that area, formal households continue to get water and wastewater services as per normal, but who's really suffered is informal settlements, and they we see as a particular vulnerability in our essential service provision. Staff is a second area of concern. We are a large employer. We have 4,800 staff, 33,000 in the city, and the impact directly on staff in protecting them going out to provide these essential services has been a second big impact. And the third is on finances. We've seen a major drop in collection rate, and we've seen the affordability of our customers decline. And we worry that over the next year, this will be even greater, and this has a big impact on our recovery program going forward. So if we just come to informal settlements, this is the 500,000 people that are provided with communal facilities. There are 500 informal settlements in Cape Town, serving 180,000 households, and we provide each of those households with a minimum supply of a shared tap at a stand post to 1 in 25 households, and a shared toilet of 1 in 5 households. We have identified that these informal settlements are the highest risk citizens within the city. We have a COVID-19 vulnerability index, and based on a range of different factors, such as density and access to services and hygiene, we've identified these as the most vulnerable of our citizens. There's been 3 main areas that we've focused on in our informal settlement essential services provision. Firstly, maintaining and enhancing existing services. In other words, keeping those water and sanitation services going, but also extending, for example, the cleaning of our chemical toilets and our on-site sanitation toilets from 3 days a week to 7 days a week, providing extra workers and providing contingency measures for absenteeism. The second is additional emergency services, and this is to about 14,000 households that were not served prior to COVID. They were not served because they were on marginal land or private land or in a wetland. And because of the hygiene needs under COVID, we've been compelled to, for moral and public health reasons, provide essential services to these households. So we've been providing tanker water through tankers that drive around the city and put up these plastic tanks, and an additional 1,400 on-site toilets which service these previously underserved areas. And the third is the health and hygiene promotion, similar to what is happening in Kigali, although I think we can learn a lot from them. This component has been about compiling our messages linked to COVID, but also linked to good practices regarding water and sanitation. Looking at impact on staff, from our large staff component, we've got 119 cases, but an additional 274 contacts. So that's around about 2% of our total staff complement. We've unfortunately had 2 fatalities, but we've also had a lot more staff impacted, as in our 63 depots, when you get a particular kind of infection, we have to do a quarantine and isolation and do a deep cleanse of that depot, and it can actually affect a lot more staff than that and the sustainability of our services over a period. Our meter reading plummeted. We were at about 85% and we went down to nearly 10% because meter readers were not as seen as essential services during the very hard part of the lockdown, but that is now recovering. We have an increase in absenteeism due to infections and due to depots closing, and that is what we are managing. We've also most recently seen a real rise in social unrest. And this is a combination of the economic conditions the citizens are in, high unemployment, and a lot of unhappiness at COVID. And this has been impacting staff directly. Stonings, petrol bombings, and unfortunately this is having a big impact on our staff. Coming into the last 2 slides. The third area of impact is on our finances. And this is probably going to be the biggest issue going forward. This is a graph of our collection rates of our water and sewage revenues. As you can see, we were at around about 80% for a number of years. We had a major program to turn this around, and we got up to over 100% at the beginning of the year, and that's now plummeted again due to affordability issues around COVID. A major program in revenue enhancement and debt management, as well as keeping our expenditure management down. This is one of the major programs of the department. I won't go into details of it now. Suffice to say that the economic crisis that we are facing going forward is going to affect all of our business and all of our revenues, and that affordability on our services is really an issue. Last slide. If we take the theme of building back together, which is something that we really do own, we are really trying to take the lessons from the drought 2 years ago and COVID to improve our services going forward. Under the drought, the key lesson there was that we needed to diversify our sources. We had a complete reliance on surface water, 98%, and now through this big build program, we are bringing that down to 75%. Under COVID, inclusive services through informal settlement provision, but also around financial sustainability and staff renewal are the big themes that we're focusing on, and this will be the major issues going forward. But essentially for us, the key lesson that we learned from COVID and from these previous shocks is that we need to build trust with our politicians, with our customers, with our citizens. And the way we do that is to establish clear priorities, and our 5 commitments are our attempt to do that. We also need the capacity in the department, and we've had to increase our staffing and increase our networks, translating these commitments into action, which we are monitoring on a day-to-day basis, but also improving the transparency and the communications of the whole service so that people know what we're doing, know what to expect, and know how we can serve them best under these kind of conditions. Thank you all. I look forward to the question and answer session.
Michael, if you can review. Thank you very much, Japheth and Michael, for this excellent presentation. We're going to now move to our discussant. The first one will be Jennifer Sara. Jennifer, you lead the program of the World Bank, the entire program worldwide on water and sanitation. We're quite keen to hear your reaction to this presentation, but also your insights from the last few months and how the World Bank has been responding to the ongoing crisis. Over to you.
Thank you so much, Francis, and thanks for inviting me to be here. I'm really, really delighted to be here. And it was such a pleasure to hear these 2 presentations from Japheth and Mike, and I congratulate you not so much for the fantastic clarity in the presentation, but the work that you've done with your utility. I mean, it's really, really, really impressive to see these are really 2 first-class utilities in Africa, paving the way and showing, and then so what I wanted to do in the words I was going to say very much mirrors the approach that you've taken. I'll even call it almost like a textbook approach on how you've been able to respond to the COVID emergency, and also think about longer term and the resilience of building longer. And I really think it's important to share your experiences with others. I want to touch on 3 things that we're doing at the World Bank on the response. The first one was really how do we align around the emergency response. And at the World Bank, the emergency response, it might be the same in many, many countries, was one that was very much a health sector response. It was led by the health sector. All of our emergency loans went to the health sector. And we realized very, very quickly that we had to kind of piggyback and work within the health sector to include water, sanitation, hygiene as part of a PPE, almost the same thing as our personal protective equipment, as the really a key to the prevention of the spread of the disease. And as we say, you can't wash your hands if you don't have water, right? So that was really important for us internally in the bank, but also in countries, to bring the health sector together with utilities and with cities. And what we saw were the 4 key activities, and in fact, both of you presented these in your presentations. The first is the importance of hand washing campaigns and behavior change. And that was really seeing President Kagame out there saying this and having heads of state. I mean, that's really, really, really important to have figures and having hand washing campaigns that are at every single level. The second one was tackling washing urban hotspots, and you both hit that, and Michael, you went into a lot of details on the low-income population and the real good data that you have on the correlation between low income, access to services, and COVID spread. The other one, of course, and I'll get back to that in a second, is supporting in the long term the water supply and sanitation utility or service provider, and how important it is to make sure, for the reasons that you enumerated, both of you. What I didn't hear from either one of you, but maybe it is there, is the importance of washing healthcare facilities and making sure that is water and sanitation provided. 40%, that's 2 in 5 healthcare facilities around the world, do not have water and sanitation facilities, hand washing facilities at point of treatment. Many of these are actually in urban areas. These are not just the rural clinics. So that's something that was quite important for us. For example, we worked in Addis, the utility of Addis Ababa, to allow them to extend services to all the healthcare facilities and also then find a way to make sure that they were getting paid for the service. So the first one is organizing an emergency response around a couple of key areas. The second one is really to address what Michael, both of you talked about, is the long-term viability and the day-to-day viability of the utility in terms of, I like the way you put it, Michael, customer, staff, finance, and also day-to-day operations. Many urban utilities can't even get chemicals, they can't, and there's to keep their operations going. So that's another issue. So I think what's important for us now is to help the utilities also as service provider, as customers there's mandated free water for many customers. We can't let the utilities have to take that hit. And so the question is, can the local government do that, or is this something that national government steps in? But I think the viability, financial viability of the water and sanitation service provider is very important because it's not just being able to respond to immediate customer need, but the increase in customers and having to deliver to these hotspots. So therefore, I think the important thing is also working with government policymakers in the sector and bringing the sector and the cities together to look at ways of designing liquidity facilities. We've done quite a bit of work on that. And also to do financial impact assessments of utilities. And both of you in your presentations, it was fantastic to see how much data you have. Data is super important, especially financial data, to make a convincing case to say why you actually do need some kind of stimulus package and should go to the utility to be able to continue to deliver services. So that's also, you talked about communications and trust and reaching out to communities. I think that knowledge sharing and building utility partnerships is really important. And thank you for this type of event, Francis, that really does bring everyone together. But the last point, and I know Henk will talk a lot more to this because this is what Henk talks about a lot passionately, is building back better. How do we actually look at the resilience and building back? And I think Cape Town was a great case, the way that you presented it, Mike. I mean, you had that day zero. You had to already deal with resilience and water scarcity, and that's going to happen more and more in many cities around the world. And then you overlay droughts and sometimes floods and water insecurity, the basic water resource, with pandemics and with additional stresses. And so I think the resilience of how you can build resilience into utilities against all these stressors is incredibly important, and we have a lot of lessons to learn. So let me just finish there. Just by saying what the bottom line for me is really how we need to work together, the utilities with the city and local governments, with national governments across all of the sectors for an immediate emergency response as we also think about the longer term building resilience. So thank you, I'll stop here. Over to you, Francis.
Thank you, Jennifer. As a matter of fact, in one of the poll made earlier, one of the questions was what was the main issue your city is facing, and most of the respondents agree with you that one of the big challenges is to get people to work together and to try to avoid overlap of mandate and just coordination and collaboration. Henk, you're one of these people who is always thinking ahead and is always ahead of most people. So we're very curious to hear your reaction and your insight, and also what you're preparing, because you always have something under the hood that is about to come out. So we're very keen to listen to your reaction.
Thanks so much, Francis. First of all, I want to thank the Global Resiliency Network and the World Bank for putting us together in this panel, but not only this one, but the whole series of conversations, very valuable for a lot of cities, practitioners and leaders around the world. Second, thank Jennifer, Mike and Jeffy for their comments, showcasing from Kigali and Cape Town how you can do better in the context of a real crisis. Like COVID-19 shows, this pandemic really hits us all very hard. And Jennifer, again, repeating messages from the partnership with the World Bank, how to really get this going off the ground. I'll try to touch upon how the challenges we face and what to do. When the crisis hit, you immediately saw 4 major challenges. One was that the immediate attention was all to relief. And that, most of the time, 99% around the world, relief is Band-Aid. And we learn this in our, in our crisis responses all of the time. I learned it myself too. When you go to places of risk, it doesn't matter how you stop the bleeding, but you have to make it stop. But that puts immediate pressure on the vulnerability of the places and communities that are already vulnerable, which often is the case in cities. It's not the pandemic itself that is the problem, it's the stacking of challenges that makes it so complex. It's fragility, it's gender, it's education, it's sometimes conflict, it's always climate and sustainability, it's food security, energy dependency, and then this pandemic makes everything bigger. So with the relief not focused on any of the other sustainable development goals, but only on Band-Aid approaches, you actually increase the gap. Now we saw immediate opportunities to, and there are many examples in Cape Town and Kigali show, but there are more, and luckily partners with the bank, as the World Bank is, helped us, the Dutch government and the European Union and others, to use that first relief already as a stepping stone towards recovery. Not easy, but possible. The second is funding. Development aid and programs are directly linked to GDPs. The relief was a budget cut in itself of existing programs, and then with a GDP loss for next year, we will see a major gap coming into place. The Dutch government just announced last week that we fill the gap for the next 2 years to make sure that our development programs are continuous, but that puts a lot of pressure on the years after. But for now, we said continuity, consistency, and commitment are important, especially in this time of the pandemic when the most vulnerable are hit hardest. But that consistency, continuity, and commitment, budgetary, is critically important. And third, when the relief it becomes a recovery, and Francis already said, build back better, or Jennifer already said, I was going to talk about build back better. There is this opportunity to ensure that the recovery efforts are not single focused. The challenges we from the Netherlands in our international partnership face is that it is often only focused on economic recovery. And that means jobs, jobs, jobs. And it also means fast results fast. And showing results fast off the ground means often you take shovel-ready projects off the shelf. And shovel-ready projects off the shelf often are not the ones that are most sustainable, and are definitely often not the ones that build resiliency and sustainability for the future. So here's the real opportunity. It's not that, this is not so much about building back, but it's about an economic recovery that can really be a leapfrog, not a stepping stone, to leapfrog towards more sustainability and more resiliency. And we have the agenda, the SDGs, 17 of them. We have a climate agreement with climate action, and there's massive opportunity for climate mitigation and climate adaptation in a very inclusive way. But then we have to put forward these strategies and opportunities to make sure that we start to implement. That's to my fourth point, and here really this is about collaboration, 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 and I think all talked about this. The pipeline of building sustainable and resilient projects is often lacking. We have a pipeline of many, well, in popular terms, stupid infrastructure, the ones that make us more vulnerable. But building a pipeline of real sustainable projects, small and big, to ensure that sustainability is built up post the pandemic, already in the recovery phase, is critically important. Kigali and Cape Town show that there is a base for that, but at the same time, that window of opportunity is small, and only through partnership that are international and local, across agencies, across institutions, formal and informal, can we get to such an approach. That means a long-term focus that is comprehensive, short-term innovative projects, in an inclusive process of building an enabling environment, and with transparency to ensure that we can also validate and evaluate the benefits and costs of these more holistic approaches. We secured the funding for the next 2 years, but the decade of action is 10, and we will need everything we can in this international partnership to take this shift. But as Kigali and Cape Town show, the pandemic is a wake-up call. We're definitely awake as a world. Water and sanitation and hygiene are more than ever front and center in the agenda. There's a massive gap of over 2 billion people on water, over 3 on hygiene, and over 4 on sanitation. And we have to leapfrog. But I think the opportunity in this international collaboration now, it's on us to show that we can not only do it in the pandemic, but in the next year and years to come. So I'll leave it with that. There are practical examples from the budgets we put in place in Africa, Central Asia, and Asia. But we need an international coalition to make sure that this is happening. Over to you, Francis.
I think Dana will now take over. Unfortunately, I think we won't have time for many questions, but Dana, the floor is yours to ask maybe 1 or 2 questions.
Great. So I think the first question goes to Japheth. I think one of the things that everyone around the world saw immediately when the crisis hit was the hand washing stations that Kigali set up, and many cities around the region tried to replicate this approach with varying degrees of success. So it'd be great to hear from you just in a minute or so. What are some of the challenges that you saw as you installed those hand washing stations, and any major lessons learned from that particular approach?
Thank you, Dana, for the question. Normally, as I said in my presentation, people were used to these hand washing facilities in public places. So maybe when the COVID started, the things were many and everywhere, and maybe the challenge that we faced was the queuing at the bus stations, where there are a lot of people moving, but the practice itself, people were already got used to it. So that the challenge was just the time people spent on the queues to wash their hands. Some learnings that we had around those, it's a good way to, it's the most measures that most people used, because it's very cheap, and the city was providing this liquid soap, especially in public places. But for businesses, small businesses, they were able to acquire them by themselves or from the trades cooperative. So I think it was very easier for the people to use them, using either the normal soap or the liquid soap.
Thanks, Japheth.
We may have time for a second question. I don't know if you have another question. I have 1 question. Jennifer, you mentioned that 40% of health facilities in less advanced countries don't even have running water. I wanted to ask Michael and also Japheth if there's similar situation in Rwanda and in South Africa, and what is being done about it Is this something that you even encounter in your city? Is this something that you encounter in the country overall? And are there specific programs to try to address this issue? Maybe starting with you, Michael, and then to Japheth.
Yeah, thanks, Francis. So the situation in Cape Town, most of our customers have full services, water supply and sewage, as per a lot of Western cities. 3.5 of our 4 million customers, but it's the 500,000 informal settlements which I was trying to focus on, which have these shared facilities, more like you will get in much poorer parts of the world. And those figures don't translate to the rest of the country. I think there are a number of rural areas where you would have not as advanced services as the city. But I think for all of our social services, our clinics and the other facilities, we would have adequate water and sanitation. There is an issue on the hygiene side. Hand washing is a problem, and a number of other hygiene elements which have really been exacerbated by COVID. So we've actually seen COVID as a way to strengthen a lot of those hygiene messages which we wanted to get out there before, on the value of hand washing to basic health as one of the 3 pillars: water, sanitation, and hygiene, in actually maintaining basic health.
Thank you, Japheth. Do you want to add
Yes.
this question?
Yeah. Like in Cape Town and many other African cities, we definitely had the issue of people who lack the capacity or the ability to, or don't have sufficient access to hand washing facilities. But in Kigali, they use the very basic facilities that they make by themselves. That they don't need to buy, like they take these small bidons, which they tie to a rope, and they make at the household level, which is very easier. And again, for the very vulnerable families, we were supported by these local development partners. That's where that's where their role was mostly. But as I said, with 77% of people in the formal settlement, they definitely had the issue as well.
Thank you, Japheth. I think that we're getting to the end of this session, and so I have the unfortunate task to bring the session to an end. I think we've heard from 2 very different cities who face quite different situation, but I was stricken by the fact that in both cases, the crisis has brought forth the issue of inclusiveness and the issue of the need to communicate. I thought our discussant who agreed, I think, with all these points, also added the need to really take advantage of this crisis too. And I mean, Build Back Better, maybe a little bit of a cliche, but to really use this crisis, as Henk said, to leapfrog toward more sustainability and resilience. Next week, we will, actually our discussion also insists on the importance of collaboration, which I fully agree with. Next week, a session will be on Wednesday and not Thursday as usual, and we'll focus on how cities have used digital technologies to address the crisis and to prepare for the new normal. I hope that we will all see you at that session. I want to thank Japheth and Michael for their presentation, Jennifer and Henk for their remarks, as well as everybody, all those who have helped organize this session, and all of you for joining us for this 20th session, and we look forward to have you at the 21st session next week. Thank you very much, and have a good end of the day wherever you are around the world. Stay safe and stay sane. Thank you very much.
Thank you very much. Bye-bye.
Thanks.
Good to see you.
Bye.
Bye.
Thank you. Bye-bye.